Welcome to ADAPT NCLEX, and thank you for selecting to watch this video. You cannot take the NCLEX without knowing what kind of questions you see, how the questions are framed. Some of them are framed in such a way that um, they want to test your critical thinking and see if you can stay focused on the question. If you watch this video, I think it will give you some idea when you see a question, what you should focus on. So the first one is, look, this is a typical question you will see, but I've given you the answers are the type of breakdown that you're going to see in the question, different way, right? And next, as attended staff education program about what? Right heart failure, right? That's what they will tell you. Then they will give you that's the stem. Then the question is the last portion of it. Which of the following assessment, the next? Then they will tell you, they will bring something else. The next you expect, right? The next you anticipate. The next knows is consistent with the diagnosis. Guess what? All of this are saying the same thing. Don't let them confuse you. Which of the following assessment the next you expect is the same thing as which of the following assessment the next you anticipate. That means I'm anticipating to see this finding in the patient. I should expect this when I examine the patient. This is what I'm going to see. And I know that when I examine the patient, if I see something, it should be consistent with the right heart failure. So I'm looking for signs and symptoms that is consistent with right heart failure. And that is what 3 is saying. Is they saying the same thing for 2? I should expect, I should anticipate, I know is consistent with the diagnosis. Don't let that confuse you. When you see that, let your mind go. Pick one of them that you're more comfortable. Consistent with the diagnosis is the same as I should expect or what? I should anticipate. Okay, so next time when you see that kind of question, that is what the question is asking you, and then answer the question. I'm looking for signs and symptoms or plan of care, whatever that is consistent with right heart failure. The opposite is that which of the following assessment is what? Not expected, not consistent. That means I should not see that. So a typical example, if I give you answers here like that. I give you answers. These are your answers, right? JVD, right? And say pink food spirit, leg edema, crackles, lung crackles, and maybe hepatosplenomegaly. And these are your answers. And I said, not expected or not consistent with right heart failure. What do you think I'm asking you? Things you are not going to see in right heart failure. That is what the question is asking you. Which one you should not see in right heart failure, right? You know there shouldn't be any lung symptoms. So I should not see that. There should not be any crackles. I should not see that. Therefore, if you pick this one and that one and that one, you wrong. The question said not consistent, not expected. That means I should not see them in a patient with right heart failure, right? Patient with right heart failure should not have lung symptoms. Therefore, pink fluid sputum is your lung symptoms. So that is your answer. Lung crackles is your answer. Even though you say, oh, I should see JVD, I should see leg edema, I should see hepatosplenomegaly. The question says, which of the following assessment is what? Not expected and not consistent. Therefore, your right answer is pink fluid sputum, which you should not see, and lung crackles. This is the example. This is how you should read the question when you see that. The next one, same thing, same story. A nurse has attended staff education program about right heart failure. Which of the following prescription the nurse should what? Question, should clarify, should be concerned about. This is a good one because look, the word prescription does not mean medication. Prescription can mean what? intervention, right? Or plan of care. All this thing can be plan of care. So when you see prescription, put your head in and said, it can be intervention, it can be actions that I'm taking, it can be medication, it may be plan that the doctor is putting over there. Therefore, all you need to do is say, there's something going on that I should question, I should clarify, I should be concerned about. Should you distinguish between them? No. It means look for an action that is wrong, an action that is worrisome, right? An action that is I'm concerned about. If I'm concerned about it, I'm going to question. Look at what I'm going to do. If I'm concerned about something, I will clarify. If I'm concerned about something, I will question. Don't let the board try to make you go crazy when you're trying to figure out. Therefore, you're looking for something that has been prescribed, some action that is going to be taken that you think, no, we should not do that for right heart failure, right? So that's your answer. We should not be doing this if you have right heart failure, right? So, example is what? I can give you example. Somebody in a right heart failure, you write bolus 1 liter over 30 minutes, right? So 1 liter over 30 minutes. And I say, I give you isosorbide mononitrate, right? And I give you what other option, like something that you know it shouldn't be doing that, right? Anxiety. Yeah, I'll give you like maybe yeah, those are the anything that is going to like worsen the individual condition, like that. You bolusing the patient with a leader, right? Or you put a patient in the supine position, you know, these you have these three orders. You can say, why would I pick somebody in a heart failure? You probably having some, I mean, edema in the basically the heart is overwhelmed. Sit them upright, right? Isosorbide is going to help with the heart failure, so that is good. Giving them a bolus of 1 liter over 30 minutes is wrong. So which one I should question? This one. Which one I should clarify? Bolus them. Which one should be concerned about? That. Another one, the same thing. Thus, you should be doing the same thing. Isosorbide mononitrate, I think is good, so you don't have to do anything. Did you get a picture? So that's the idea. When you see the question, try to put them all of them as one. And this is the good one. I want you to get it. I put all together. Okay, I thought about them. I put it all together. So which is it? And next, as attended start of education program about right heart failure. Which of the following you see I put teaching, right? Action, right? Intervention. You see all of this, they change one word. Teaching, you teaching them something, you got to do something. Action, or they providing some intervention. All of them, they will change the end of the question, right? They will say teaching, you should question. Action, you should question. Intervention, you should question. It means the same thing. You should clarify, it means the same thing. You should be concerned about, it means the same thing. What again do you see? Intervene. That means there's a teaching that is wrong. I should intervene. The teaching that is wrong, I should question. The teaching that is wrong, I should clarify. The teaching that is wrong, I should be concerned about. The action that is wrong, I should question. You see the thing? I should intervene. An intervention that is wrong, you should be concerned or clarify or question. If they don't use those words, question, clarify, concern, or intervene, they will use not indicated. That means it's not appropriate to use that intervention. It's not appropriate to take that action. It's not appropriate to teach them that teaching or provide that teaching, or not appropriate. You see, the another way that they try to confuse you is follow up. When they say follow up or need further, it means the same thing. It means something that you see you are concerned about. You see, Need follow-up, I'm concerned about. Need further teaching, that means inappropriate. You see how all of them, you can put them together. So you can take a picture of it and put it in your mind that need further teaching means something bad, I have to correct it. Need follow-up, something bad, I have to correct it. You can use your own language. Not appropriate, something bad, I have to correct it. Not indicated, something bad, I have to correct it. I need to intervene, something bad, I have to correct it. Should be concerned about, something bad, I have to correct it. Should clarify or should question, something bad, I have to correct it. I intentionally repeat them so that you can see how it sound in your ear. So you figure out the way you can approach these things, and you can do that. Last one. A nurse has attended, I know, I think that's another one. The nurse has attended staff education program about right heart failure. Which of the following teaching action intervention the nurse should is indicated or is appropriate? That means it's the same thing we started with, right? That means indicated. That means this is what I will do. And a teaching I will do, an action I will take, an action that I will provide as an intervention, which as the intervention is appropriate, the teaching is appropriate, the action is appropriate. That means you get to do the right thing, right? Right teaching, right intervention, right action, right? You know what I mean, right? It's like example, let's provide CHF, right? So if I'm providing teaching, I would say, I mean, avoid no processed food, right? No processed food. That means low sodium, right? So weigh yourself daily. You wear the same clothes, the same, use the same scale and everything. All of them, you're teaching them. If you take hydrochlorothiazide, I would say eat some banana, or I would say avoid banana. If you take spironolactone, I would take, I would say eat banana, right? And I would say moderate exercise a little bit, okay? Moderate exercise, basically walking 3 times a day, right? 3 times a day. No, 3 times 30 minutes per week. That's moderate exercise. Then you say which of these is appropriate, which of these is indicated. No processed food is what? Indicated is appropriate. Weigh yourself. Low sodium and sodium is indicated and appropriate. Weighing yourself is indicated and appropriate. Hydrochlorothiazide, you're going to have low potassium. You should eat banana. Therefore, this is not indicated. So I'm not picking that as an answer. Spironolactone should not be eating banana. They should avoid it. So this is not indicated, it's not appropriate. Moderate exercise is good. So that's the teaching, the action, the intervention are not indicated or appropriate. And now this one. A nurse has attended staff education program about right heart failure. Which of the following action the nurse should what? Take, this is the prioritization. Take first, do it next, immediately, or follow up on it. They sometimes is the same thing, right? What is the first thing you should do? What is the next thing you should do? Is the first thing you should do. Is the whole, all of them is talking about prioritization. What do you do immediately? Yeah. Sometimes they say the action you need to follow up on it. That means it's opposite of what you should be doing first. So I just put it there, I put it on red so that you can see that. But first, next, and immediately are doing the same thing. And then if you have to follow up on something you're concerned about, this can be a priority. So you follow up on something because you worry about it. If you see in the next generation NCLEX questions here, the cases, they say which of these we need to follow up. That means it's a priority question that I need to follow up and get more information on, right? Sometimes can be a follow-up that they're doing something wrong. It can be a follow-up that you see something bad and you want to know more about it. This is the way to approach the NCLEX question. Take care of yourself, and thank you for deciding to watch this video. All the best of luck. Bye.